I was doing that for the folks. Okay, there we go. Good afternoon and welcome to the work session of the Wake County Board of Education. Today is November the 2nd. I want to welcome everybody here, both that are joining us here and online. We've got a few board members that will not be with us today and some that will be joining us shortly. So we will get right into our agenda for this afternoon. Superintendent Moore, I'll turn it over to you. Good afternoon, and you can set us up.
Good afternoon, Chair Sutton, board members. Our first item on the work session today is the School Mental Health Improvement Plan. You will recall this is a plan that all districts are required to submit to DPI with an update that comes to the board in the fall, and that's what we're bringing today. Mr. Coe.
Good afternoon, Chair Sutton, Superintendent Moore, and board members. Today I'm here to present an update of our School Mental Health Improvement Plan per the North Carolina State Board of Education Policy, SHLT 003, which was approved by this board on July 20th, 2021. I'm also joined virtually by Dr. Marius Pettiford, Senior Director for Counseling and Student Services, and joined in person in the back by Kelly Lister, Senior Administrator of Crisis Prevention and Intervention, and Cam Lopes, Director of Special Education, Social Behavior Programming, and Extended Content. I'll wait for the slides to appear. And if we can go to slide 2, please. During the last conversation about this School Mental Health Improvement Plan on July 20th, we provided an overview of the behavioral health, the proposed mental health plan, and next steps. In today's presentation, the focus is on our progress of work. And by the end of the presentation, we hope to leave you with the following: an overview of how this work fits within the context of behavioral health, a review of the SHLT 003 requirements of a school mental health improvement plan, provide an update on each of the components of the plan, and confirm that the district has submitted the plan to DPI as required. This slide is a reminder that the social and behavioral supports in our district are offered, like our academic programs, in a multi-tiered system of support, and building a district framework with the ability for school leadership to provide a 3-tiered model of support. Our continued work for all students, with an emphasis on those students who may face additional challenges, is supported by the School Mental Health Improvement Plan that we're sharing with you today. And since March of 2020, we've done a great deal of work to broaden our understanding and capacity of behavioral health. And of the 3 components of behavioral health, today's presentation will focus on mental health. And in the slides that follow, you're going to see extensions of current work and new work that will focus on sustaining and improving the mental health of students in WCPSS. I'd like to provide you with some context of the district's history again, of exploring and addressing the mental health needs of students. These efforts date back to 1993, and you can see that this next step to develop and implement the mental health improvement plan sits on a foundation and ongoing district support that we plan to continue. And you can see from the timeline, in conjunction with Wake County Human Services, now called Wake County Health and Human Services, we developed a collaborative school-based mental health team in 1993. And around this time, the district also partnered with Holly Hill to offer day treatment to students facing severe challenges. And the first version of a school-based mental health team responded directly to schools and for specific student conditions and situations. And eventually, this included direct consultation with Wake County Human Services staff around intensive co-developed interventions. And from 1993, I'll share a few of the highlights to orient you to our history as a district. In 2002, we added a threat assessment called Threat Assessment Management and Consulting, also known as TMAC, in WCPSS, implemented by an outside agency. In 2003, we began implementing signs of suicide for 9th graders. In 2007, a district crisis team was Prepare trained, which is Prevent, Reaffirm, Evaluate, Provide, and Respond, Examine, crisis prevention program. And in 2009, we developed MOUs with Southlight, Poe Health Center, Hospice, Interact, and Safe Child to supplement our supports for students and families. In 2010, our TMAC contract ended. And in 2012, our school-based mental health agreement with Wake County Human Services ended. And then we entered into an agreement with Alliance Health to provide services to WCPSS. In 2013, signs of suicide for 7th grade students were added and restorative practices began to expand. And in 2016, we required the use of threat assessments and began our trauma-informed work by adopting the CRIM, or Community Resiliency Model, through the Trauma Resource Institute. In 2017, we added a 12th grade curriculum through our Signs of Suicide program. And in 2018, we added Funny Tummy for 1st grade, which is crisis prevention and intervention, through the school counseling department. And of course, since March of 2020, we've focused on the social emotional learning and health of students, and the school mental health improvement plan is the next step of a strong system of support for our students. In the upcoming slides, I'll be sharing about the components of our school mental health improvement plan. And first, to set some context again, back in June of 2020, Session Law 2020-7 was approved by the North Carolina General Assembly. And it's an act that requires the State Board of Education to adopt the school-based mental health policy and requires K-12 public school units to adopt and implement a school-based mental health plan that includes mental health training and a suicide risk referral program. And the North Carolina State Board of Education then adopted policy SHLT 003 that aligns with this legislation and details compliance requirements. And the intention of this policy is to support students with the mental health component of behavioral health while further training staff to help identify when students may need more intensive mental health support so that we're able to connect both students and families with the appropriate community resources. If we can go to the next slide. And this policy requires us to include 9 components in our school mental health improvement plan that you see here on this slide. Only 6 areas of the plan components are required in the actual submission, and those are the universal prevention through core instruction, curriculum, and environment, early intervention for mental, social, emotional health and wellness, referral, treatment, and reentry, MOU with the local mental health agency, managed care organizations, suicide risk protocol, and stakeholder engagement. And as we review each component, it's important to note that the annual reporting process to DPI is a self-assessment. And while you see that we are meeting the requirements, we have identified focused areas of growth, which will be briefly discussed. And the requirements listed come directly from each component in the policy. So within the universal prevention component, the district is already meeting all of the requirements, though this isn't an exhaustive list. A few examples of our work in universal prevention are the evaluation of understanding and use of social and emotional well-being learning strategies in the classroom, school management as expectations for teachers and administrators, and an exemplar practices are the core behavioral health practices that we've been implementing for quite a while now. Also, improving staffing ratios for licensed specialized instructional support personnel. That's another area that we've met, and an exemplar practice is the hiring of additional counselors, social workers, psychologists, nurses, and instructional specialists. And in this area, a focus area for growth is to integrate social emotional learning strategies across the curriculum and school environment. And a practice or program that we have in development is the implementation of the universal screener through our cohorts. For this slide, the district is meeting all of the requirements listed within the early intervention for mental, social, emotional health and wellness component. And a few of the examples are in terms of the annual review of the public school unit's policies, procedures, and or practices for crisis intervention. The exemplar practices that outline that we've met this outcome are the crisis plan reviewed and upgraded annually by our district crisis training team that also includes human trafficking and sexual assault awareness training. In the area of identifying strategies to avoid over-reliance on suspension or expulsion of the discipline of students with identified mental or social emotional health or substance use concerns, that practice is met. And our exemplar practices are the restorative circles for both, restorative practices, both in the circle keepers model and the mediation and the work around community resiliency model. The focus area for growth that we have is to continue to identify strategies to avoid over-reliance on suspension or expulsion in the discipline of students with identified mental and social emotional health or substance use concerns, And a practice or program in development is the expansion of our restorative practices, community resiliency model, tied to the behavioral health needs assessment and the universal screener data. In the referral, treatment, and reentry component, we are meeting all of the requirements, and the example of this is that under the strategies to improve access to school and community-based services for students and their families, we have implemented supportive counseling as of 2020, and the focus area for growth in this area is access to mental health services being more readily available to students and families. And a practice or program in development is our school-based mental health services. And in the next slide, the component that requires us to have an MOU with our local management entity or managed care organization has been met. WCPSS has had an MOU with Alliance since 2015. And a focus area for growth for us is to increase MOUs as needed with local mental health substance use agencies and providers as needed. And our practice or program in development are to increase our supportive counseling MOUs. In this next slide, the component that requires us to have a suicide risk referral protocol has been met, specifically around the guidelines on the identification of students at risk of suicide. We have an annual staff awareness training, and under procedures and referral sources that address actions that should be taken to address students identified in accordance with the subdivision, we have our suicide assessment protocol. And our focus areas for growth are to expand training to school staff, administrators, and families as needed. And a practice or program in development is the expansion of student family awareness sessions that occur after hours and weekends, and then keeping your child emotionally safe and healthy is an example of one session that specifically addresses suicide awareness. And under the stakeholder engagement component, it notes that each public school unit shall provide for engagement of relevant stakeholders, including families, students, and community providers and cross-system partners, with the goal of building school, family, and community partnerships to create and sustain coordinated mental and social emotional health and substance use supports and services for students. And this is an area we've also met the criteria, and specifically around our mental health services collaborative. And our focus area for growth in this area is the addition of students to the mental health services collaborative that currently involves staff members and parents. And then the practice or program in development is to proceed along in our development of a school-based mental health pilot. And so a copy of the school-based mental health plan adopted by the board, the mental health training program and suicide risk protocol were uploaded as part of our report submission. A link to the submitted plan is in that slide for your review. And then just to note, the school mental health improvement plan was submitted on September 15th through the Healthy Active Children's Report as required. And this is to be an annual report and will be continue to be submitted as part of the HAC report. So thank you for the opportunity to present around this work. And now we'll pause for any dialogue or questions.
All right, thank you, Mr. Coe, for that report. Looks really impressive. Mr. Haggerty.
Thank you, Mr. Chairman, and thank you, Mr. Coe. As you know, this is an area that we've all been very invested in, and we all rank as a very high priority. 3 quick questions in regards to the programming that's discussed in terms of training in the various areas. How is that programming selected and reviewed? I know, for example, there's a lot of public resources out there that might offer free programming, but how is it vetted? How do you choose what you use for this program?
I know it's done through a very, a vetted process amongst our teams. There's discussions around the options that we have, but I also wanted to open it up to any of my in-person members or Dr. P if he's online, if he wants to add to that. But there is a vetting process, and I think we're trying to be really clear about what the needs are, and then how do the partnerships support the direction that we're headed. For example, if it's related to the awareness training around the sexual assault or sex trafficking, if we are partnering with anyone, we want to make sure that the folks we are partnering with are in alignment with what we're up to. So it's a team-based effort. It's not just one person deciding on what the best program is on our own.
I appreciate that. Two other questions really quickly. Access to services, I see that the goals have been met, and I just wanted a little more information how we've been able to meet these goals with the community demand for services so high without a lot of additional resources available. I know a lot of people are struggling privately to get access to these services, and I was just curious how we've been able to succeed in that.
Yeah, I think it's our team trying to be creative with the funding pots that we have. And so if we are able to reallocate some resources and then implement things like supportive counseling, I think the ESSER funds have definitely helped Mr. Haggerty, so that in the next 3 years we have some funds in place to be able to do these things. But with whatever pots of money we have, we try to think about things like supportive counseling so that we can increase the level of access for, supportive counseling is not necessarily for the crisis level situations, but when it's moving in that direction and there's additional supports beyond the school that's needed. And same thing with our community liaisons, right? During the pandemic, there's new issues that we saw arise with being able to stay in contact with families and students and to see how they're doing. So in terms of that, it's through, Dr. Pettiford and the CAST team's contacts of reaching out to, for example, retired social workers who've worked with us before and contract them to become community liaisons to go do the home visits and check in on families that have not either engaged with us, I think back when we were in a virtual session, or even now when we're working through any students that we have not yet had regular contact with, following up. So those are the ways in which we've expanded the program. And I think, going to, we've called it most recently like the SEL expansion case to the local funds that we've asked for the past few fiscal years. I think the hiring of additional people also helps at the school level to make sure that those folks are trained on all the resources and programs that we have available so that when a specific situation arises, our folks are trained well enough to direct it to the right people at the central office level for support.
Was that something we got out of county funds or out of ESSER funds or some other grant?
I think it's a mixture. It's local, federal, and some of our ESSER funds that allowed us to do those.
Thank you. And then just finally, the last question I had, stakeholder engagement, we talked about developing a school-based mental health pilot, and I was just curious sort of what you thought that looked like or what you would envision for that.
I can actually ask Cam Lopes to come on up and share a little bit about that.
Good afternoon.
Thank you.
The RFP for school-based mental health was just released, so we are waiting for the agencies to respond to that RFP. On November 19th, there will be a committee reviewing those agencies. We will hopefully have an elementary, middle, and high school in each region where the pilots will, we will work closely with the agencies to come in. Ray Marsh is our school-based mental health coordinator, and she will be the one overseeing this pilot, and we have the 4-year plan, I believe it is, where it will hopefully then expand out to all of the schools within our district.
I guess just for clarification, though, can you describe what the pilot is or what it does in terms of, is it, this is under the stakeholder engagement indicator that we have here, just, what would it look like in a school?
So we will have actual therapists coming into the school, and the MOU is that the principal will have a location, and the counseling and social services group will then identify students who are appropriate for the school-based mental health, and we'll work with that agency. And then there will be processes that we follow to communicate closely with the parents as well as the counseling staff.
Okay, wonderful. Thank you.
You're welcome.
Yeah, and Mr. Haggerty, one more thing I might add is that there's the school-based mental health pilot, but there's also the collaborative that currently exists that guides just what type of programs do we need, and that's the one that currently includes parents. But one of the growth areas that we've identified even in that collaborative work is, can we bring in some students to actually help guide us further so we have additional stakeholder input on what are the mental health needs that we see in our schools. Yeah.
Thank you, Mr. Haggerty. Mrs. Kushner.
Thank you, Chair Sutton. And as a follow-up, can you tell me how many students that you're looking to include and how those students would be
I think
chosen? And I'm thrilled that we're going to elevate that student voice. Thank you.
I think I'll have to touch base again with my team, Ms. Kushner,
Okay.
about how many slots we'll need to fill, but I think we don't want to limit it, but I'll touch base with Dr. Pettiford, and once we understand how many students we'll need, if we can get board support to get the word out, we'd love that.
Because I have to tell you, whenever I've been invited during the last year and a half to a student session, the mental health needs that they are feeling has come to the fore. I mean,
Yeah.
so it certainly is on their minds every day. And I don't know, Ms. Lopes, if you want to, she was chomping at the bit to,
Yeah.
I think, answer that. Thank you.
We're working closely with Equity Affairs, and she has a group, and we're hoping to have, I believe, about 3 to 5 representatives on our collaborative meeting.
Fantastic.
We hope to start that next month, I believe.
Thank you. Thank you very much for that inclusion. I appreciate that. And my other question was how, given, it's on our forefront of our minds right now, the labor pressures that we have, and I had seen in all the reports of ESSER funding and budget updates that there are lots of different pots of money that we're trying to pull and support social emotional professionals. How is that hiring going, and are we able to find the professionals we need to serve our students and families?
I think, Ms. Kushner, the labor crunch is definitely real, as you said, and we are working at it, and I think we're chipping, I would say the pace at which we're hiring is that we're chipping away at it over time, but it's not like there hasn't been a huge influx of people who are, like, the labor pool is not large, but I think whenever we find the right folks and the candidates, we try to bring them on board right away, and that's been an ongoing process since this past summer.
Thank you.
Yeah.
Thank you, Chair Sutton. That's it.
You're welcome. Vice Chairman Haffey.
Thank you, Mr. Coe and Ms. Lopes and everyone on this team. Kind of a follow-up, and I feel like I already know the answer to this, but I'm going to ask just in case I missed it. As we grow, as we make these changes, all of that funding is funding that we have to find. It's not written in the plan that there's an increase in funding coming from the state for this plan. Is that correct?
Yeah, we have not heard what the increase in plans from the state level will be, but I think this is where we will, need the support of the board and our leadership to advocate at the local level, and then see if there's any federal funds that can come to support this. And right now we have, like, ESSER, for example, for the next 3 years to supplement the needs that we have. So,
Yeah.
but at the state level, I'm not really sure what is in the works,
But
if anything.
Yeah. And as we go to expand that pilot, that obviously, I'm just thinking out loud. But you don't have to
Yes,
answer
ma'am.
that.
Yeah.
All right, thank
Yeah.
you.
I see where you're headed.
Mr. Cole, a lot of these efforts were already sort of in the works or in play with the district now for a couple of years, as there's been a heightened focus on social emotional learning and well-being. Then over the last 18 or 20 months, obviously with the pandemic, there's even more of an awareness around these issues. Can you just speak to a little bit about how much of this was sort of ongoing work of the district and how much of this has kind of been brought about by the pandemic, so to speak? And then you just kind of touched on the board advocating for that, but what role can the board play, if any, to be more supportive in this work? And I turn to sort of Superintendent Moore to maybe ask him the second question.
Yeah, thank you for that question, Chair Sutton. I think, first of all, going back to that slide with the timeline, this is something that we focused on since about 1993, and we set some foundational pieces both around things like suicide awareness training or trauma-informed training that has evolved into practices like restorative practices, community resiliency models. So that was ongoing work prior to the pandemic. But I think what the pandemic brought to us in the last 18 to 20 months, like you asked, is that the fact that the regular place of school was paused, initially when we had to close schools, and then being in virtual and not being in school regularly like our students are this year, that highlighted further what the mental health needs of our students were. And I think for us, we realized that given the format of schooling that's evolved since the start of the pandemic, we've had to figure out other ways, like through community liaisons is a good example. How do we actually find people who will go do the reach out? that's not asking like a social worker to do double duty, but supplement the work that social workers are doing at the school to go make contact at the homes of our students and families to actually figure out, do y'all have any needs that are at the basic needs level, like housing, food, supplies, to like, are there any other things going on? And so I would say it's been an uncovering of those needs, trying to get as specific and meet those needs, both from kind of like a macro level, but also at the school level, going to an individual level. But I think the pandemic's uncovered also some, kind of macro level crises like the eviction notices that have been coming, that has definitely impacted like our McKinney-Vento numbers, for example, right? And so these are things that we're trying to evolve with over time. And I think I can start and pass it to Superintendent Moore, but I think the more that mental health is on a spotlight of conversation from the board, I think that would really help us like maintain the spotlight, even after the pandemic, to make sure that this is something our students need always.
Just in the ways that the board might be able to be supportive.
I do think that continuing to provide a public presence to the work that's happening and where the gaps are is going to be important moving forward, so that our communities, our stakeholder groups, our legislators, our county commissioners are all aware of that need. I think as the largest district in the state, we can take some action to really bring a highlight to the issues that are statewide and nationwide. Whether it is destigmatization of mental health services and the need for support, or actual volume in terms of resources available and access to them that is readily available to our students and families, adults and children. I think we are seeing in our schools the result of decades of a lack of funding and access to resources, where adults who have not had the opportunity to have issues addressed have children who are in our schools. And I think that there's a cycle that's going through all of this, where we really must pay attention and dedicate both time and resources to it. And I think we have a forum to do that, and I think that would be a really good opportunity for the board. And whether that's additional presentations, follow-up, examples, stories, all of those are options.
And Ms. Johnson, also I see you raising your hand, and I almost want to sort of lob this question at you, simply because, and I guess to your point, Superintendent Moore, with the addition of the extra resources, typically, as you see in Ms. Johnson House, your field of work, when there are more opportunities to report, then you see more cases or incidents of, in your work, sexual assault, but the same, I think, in mental health. So I guess my question is, are we, now that we're seeing the increased funding, the heightened awareness, more opportunities, are we in fact seeing, and particularly when you look at athletes that are now making mental health issues more prevalent, are we seeing that sort of response, increase, opportunities for reporting? Now, are we seeing more cases or incidents? So I'll.
Sure. And of course, I wasn't going to ask any question because Mr. Haggerty asked actually the questions that I did have. So I was like, I'm good for today. But then you asked the question, kind of what could we do? And I think essentially, Superintendent Moore, you outlined it well. To your question, Mr. Sutton, absolutely. I mean, I'm an advocate for reminding people that when you know better, you do better. And most of us, we just don't know what we don't know. And I think when we talk about mental health and services, we have to be clear. I'll speak for myself. I came from a family that it wasn't even stigma. It just wasn't talked about, right? Like, so if you're stressed or have anxiety, we just called it stress or problems, and nobody really dealt with them. And it's an ongoing question that we have in my profession of, we have a tendency, because those of us who are adults grew up in those generations, all of us, regardless. I mean, you can almost say across the board, people just didn't talk about it unless it was egregious and outwardly open to your family. Now that we have resources, we're trying to make it, of course, available to everyone. Mr. Haggerty mentioned it is hard to get into a therapist in your community. If you didn't have a therapist before COVID, it is hard to get a scheduled visit, even through telehealth. So for me, that's a good thing, that the increased requests and needs are there. And I think the thing that I would say to us as a school board is when we expect that, it is also our responsibility to normalize that in our communities. And by normalize it, I mean to our parents, and making sure that they know that it is expected that our children have language that we didn't have to describe what's happening to them. It's expected that our children will make a request for support and mental health services because their social world has made this completely acceptable. And you mentioned athletes. You can't look at Instagram and not see something about mental health services in a supportive manner that didn't exist before. That doesn't necessarily translate to those of us as parents because it's not the algorithm that comes to our social media platforms. And so for me, I think that's the thing that the school district and all of us at this table can do is normalize the need to parents so that they don't have heightened anxiety when their children start making requests. Literally, if you call Holly Hill today, there isn't a bed. And for me, the hard part that I wasn't going to put on the table, but now that you asked me, the concern for me is the alternative for our older adolescents is they will lock them up in a prison facility if they've caused harm because there's not a mental health bed. Now, I will say Wake County's done a great job under County Manager Ellis. This was a priority for him, but the gaps still exist. And so we have some of our students who are in trouble in our schools because the manifestation of the level of stress and anxiety is showing up, and they've asked for help, and we can't provide it. And by we, I don't mean just the district, I mean collectively. And so we certainly see our kids being punished for things that they really needed mental health interventions for. So again, I know this mental health plan was tough for most school districts, but as a policy advocate, we saw it as a necessity because we have to create policy to sometimes move to do the right thing for our community. And this was one of those policies that was certainly a headache for most school systems. But what we know to be true is we can already see it across the country, and specifically in some of our smaller districts, finally having access to telehealth mental health services that didn't exist prior to COVID. So again, we're a fortunate district, but it also means more people, a bigger gap in providing the supportive services that are needed, especially, like I said, for those who didn't have financial means or health insurance to have those things in place before COVID. So the numbers are up. The gap is there. And then again, I think bigger picture for me is how do we help parents kind of figure out how to navigate this? And I mean on both ends, right? When this is manifesting in our school, it means there are other children in a classroom or a school setting that is experiencing the manifestation of a child's anxiety, stress, or whatever mental health issues they have. It's showing up. And if we don't describe to our kids that this isn't just bad kids, these are things that are unchecked with their mental health, and how do we provide supportive environments? And we have to explain that to our entire community.
Ms. Scott. Thank you, Ms. Johnson-Hostler.
Well, I wish I could just replay everything Ms. Johnson-Hostler just said because it's so incredibly important. Conversations I had, especially with parents of high school students during the pandemic, talking about mental health concerns, and as someone who's been very open with my own experience with depression as a teenager, and talking to them about therapy. A lot of the times I would hear back, well, my husband and I didn't do that. We don't know what that is. We don't even know what that's like. They picture like a couch and somebody laying on the couch, and it was a strange thing to them because it was not their lived experience. And thank you so much for reminding people how mental health and trauma can manifest in behavior. I try to remind my own children that all of the time when they might express concern about a peer to think about that with an empathetic lens, and you never know what somebody else is going through. We say that a lot, but I hope people really can take that to heart. I wanted to express that I absolutely support this work. I know our district is doing everything they can. I'd like to stress to our community as well, because a lot of times we hear critics say, you're the Board of Education. You're just supposed to teach. And this is required by our state for all public schools, including charter schools, and because of the importance of mental health, potentially being a barrier to children accessing their education, accessing the subjects that they're learning in school. It goes hand in hand. And I definitely want to remind our community that it not only is this something I think our board collectively believes in, but that it's also required. And I hope people can take a moment to think why it's required, and perhaps it just is that important. So I just wanted to stress that. Thank you, Chair Sutton.
Thank you, Mrs. Scott. Mr. Cole, thank you and your team for the presentation. Thank you all for the questions. Mr. Haggerty, Ms. Scott, Superintendent Moore, Ms. Johnson-Hostler. The conversation is an important one, and sometimes just having these conversations at the table is as important as anything and part of our job as advocates. And so if we don't have the conversations, oftentimes doesn't get heard, it doesn't get talked about. So thank you for the conversation, and thank you for the information.
No problem. If you're wondering why I'm standing up here, I'm on the next item also.
All right, moving on to the next topic. I was wondering why you're going just standing there looking at me, but voluntary COVID-19 testing program update. Mr. Coe.
Yes, sir. So good afternoon again, Chair Sutton, Superintendent Moore, and board members. We're here today to share updates regarding the implementation of our voluntary COVID-19 testing program. I'm joined by Dr. A.J. Mutillo, who will share updates about possible upcoming federal vaccination mandates for our employees. So I'll start by providing you an overview of each phase in our voluntary testing program, like we discussed at our last board meeting. So again, phase one includes the approval of our MOA with Mako Medical. It involves setting up voluntary testing with schools with active or potential clusters and setting up voluntary testing for central services staff. Phase two includes expanding voluntary testing to all schools. And phase three will be guided by federal mandates from President Biden and organizing mandated testing for unvaccinated staff. And so our district's voluntary testing program will be pooled testing administered by Mako staff in our schools and central services location. And one of the key things we want to point out is that parental consent is required for participation for our voluntary testing program. And consent covers any pool testing and any individual follow-up testing that may be required as a result of a positive pool. So I wanted to share a little bit about the pool testing format. So how it will go for the pool testing is that Mako will pool 6 individuals at a time through a PCR test. And if a pool is positive, individuals will have to complete a follow-up test. And this is a way to test more people at once and determine of the pool tested who will require follow-up individual tests. And if a pool is positive, if a pool test returns positive, the participants in the pool do not have to stay home per NCDHHS unless the individual is symptomatic. And if an individual in a pool has symptoms, they should isolate at home. And if there's any refusal for some reason for follow-up testing from a positive result pool participant, WCPSS will require the individual to stay home from the school site until retesting or return to school criteria are met. So with that, I wanted to review some key points related to the voluntary testing and quarantine requirements. And just as a note, this is a slide that was revised. So I just want to make sure you're in the revised PDF that's in Assembly and not the original one. So this is the only one that had an adjustment. But in terms of this slide, individuals who participate in the voluntary testing program, they are still subject to return to school criteria set forth in the Strong Schools Toolkit if they have symptoms. And they can return through one of the following 3 pathways if they have symptoms, and that's at least 10 days since the first symptom or an alternative medical diagnosis or a negative COVID-19 test. Also, if an individual, including someone in the testing program, is a close contact of someone diagnosed with COVID-19 and required to quarantine, the same options to return apply from quarantine, which is the 7-day, 10-day, and 14-day options. So with that context, we wanted to share a little bit about where we are in the process with phase one. So we're in the process of finalizing the details in our MOA with Mako, and though this is slower than we anticipated, we are targeting having the MOA for our 11/16/21 board meeting for approval. And we have 2 schools with active clusters, and we are working with our area superintendents to determine additional schools for phase one. And we have determined the central service locations, and we're finalizing steps with Mako about the process of voluntary testing at our central service for our central services staff. And a communication plan has been developed, and we will send that out once the MOA, the phase one schools, and central service locations are ready for testing. And for phase 2, I'll just keep going. For phase 2, though we are prioritizing the rollout for phase 1, we are also in the process of laying the groundwork for phase 2, and we'll work with MACO to add schools on a rolling basis. And at this point, I will now turn it over to Dr. Matillo, who will talk about where we are with phase 3.
Good afternoon, all. In early September, President Biden announced a COVID-19 action plan that will impact all of our employees. As a part of this plan, employers with 100-plus staff members must ensure that their workforce is either vaccinated or those who are not test weekly in order to report to work. On October 12th, OSHA provided a draft of the Emergency Temporary Standard, or the ETS, that I'll refer to it as, to the White House. So while we initially heard that the ETS could be published very soon, it does remain with the White House's Office of Management and Budget. So we won't know the timelines and other details of the ETS until it is published. Once the ETS is published, the North Carolina Department of Labor will have 15 days to decide whether or not to adopt it or to adopt an equally effective standard. Additionally, North Carolina will have 30 days from the publication of the federal rule to implement it or take alternative action. Until the federal ETS is published, we won't know if our state will adopt it or adopt another rule. And once it's published, we will need some time to study it. So at this point, we don't have the information we need to begin implementing the unpublished ETS. So as we wait for that, HR and technology services continue to work together to develop a portal so that employees can submit vaccination information when that time comes. As soon as we know the details of the federal ETS and any decision by the state regarding adopting an alternative rule, we will use this portal to collect vaccination documentation from our staff. We've also already partnered with MACO to offer voluntary weekly pool testing for our employees. MACO has indicated it has the testing and reporting capabilities for more employees to participate in the program. But once we know more about the ETS standard and whether or not the pool testing will be sufficient for that standard, we'll go ahead and finalize our details with that. So I wanted just to provide that brief update. Essentially, we continue to monitor, work on the tool while we wait for the publishing of the ETS. So thank you all. I'll turn it over to Mr. Coe at this point.
Thank you, Dr. Matillo. So in summary, we're preparing to launch phase 1 while phase 2 and phase 3 are being worked on. And our MOA to the Board of Education, we're targeting for that to be approved by the 11/16 board meeting. And we're working with our schools with active or potential clusters and our areas and MACO to set up this voluntary testing program. And we're also working with MACO to set up the voluntary testing program at our central service locations. And our communication plan will be ready to share with families, schools, and staff. And additional schools will be a part of phase 2. And as Dr. Matillo said, we're working on proof of vaccination submissions process as we speak. So now I'll pause here for any dialogue or questions.
All right, Mrs. Carter.
Thank you. And thank you for this update. And I just wanted to kind of circle back. Look, I have a couple questions, but for the employee, the portal, so that means it will be electronically submitted? That's what it sounded like to me? So, okay,
Yes.
So that to me is great. I've heard of other employees or employers doing that, and that kind of lessens the burden on staff as well. So as far as having someone in a school building having to process all of that manually. So I just wanted that correct. Okay. All right. Thank you. And then the other question I had was about the follow-up testing. Are families allowed to do follow-up testing at a different location, or if they're part of this, have to have it done at the school? And I just asked because, let's say they get the phone call Friday night or Friday evening, and instead of waiting till Monday, they could go over the weekend to go ahead and find out instead of waiting 3 days. Is that an option, or is that something being looked at? Or
So, Ms. Carter, thank you for that question. Let me talk with both the MACO folks and our health services team to see, like, your Friday night scenario, what is possible there, and so I'll follow back up, maybe over email or at the next board meeting. Yeah.
Mr. Hagerty.
Thank you, Mr. Chairman. Mr. Coe, just two very quick questions. The first was when you talk, and this first one may actually be for Mr. Mattila. With the administrative rulemaking that has to take place, I wasn't sure, is this something that'll go through the State Board of Education, through OSHA, or who's the executive agency that you'll have to submit that to?
Yeah, it'll be the state submitting to OSHA, right? Jonathan, correct me if I'm
My understanding is the Department of Labor, it's going through that. It's not like the General Assembly or the State Board of Education. That's my understanding.
Okay, I appreciate that. And then finally, just Mr. Coe, I know there's a lot of terminology we use, but I know sometimes there's been some confusion. When we talk about pooled testing, you know, we're taking testing from a pool, a sample of students or staff, but they're still individualized tests with individualized results. Isn't that true?
Yes.
No, it's
So the
true.
pooled part is, so phase one of it, Mr. Haggerty, is that the 6 people at a time, that's a random, anonymized, like, way to just essentially litmus test the pool to see is there positivity amongst these 6 people. And then the individualized part comes when, if any one of those 6 people indicate they're part of a positive pool, then all 6 of those individuals would have to get a follow-up test to determine on the individual basis, are they positive or not with COVID.
So I just want to be clear, because there's some confusion. It's not that all of the tests are combined and you can't then pull them out, or is it, I guess, because I think Ms. Carter and I have some questions. Would you like to?
To me, if there were individualized tests, then you would have individualized results, which then would negate the need for a follow-up.
Yes, ma'am.
So that was my understanding, that there is no, the 6 will be just, okay, done.
Provide the scientific details of a pooled test. So, and many of you have had a COVID test, I'm assuming, so you get the swab, it goes into the little vial. So what the pooled test presumably would do, this would be the normal protocol for a pooled test, is you pipette a bit out of each of 6 random tubes, put it into a single pot, you do the PCR analysis on that single pot. That single pot is the combination of those 6 randomized people. You know who the 6 randomized people are, so that you know who was in that pool, even though it was randomized. You don't know which of those 6 tests positive. Now, the follow-up question that I have to that is, I'm not really understanding the retest issue, because in a normal pooled test, right, you don't use that full sample volume for the test. So if I pipette out the 1/6 to create one sample, I've still got 5/6 of that sample left over. So in a normal pooled test, I would then still have that remaining 5/6 of the sample that I could then run a test on without doing a subsequent analysis. So is that being done? If not, I'd like to know why not, because that would be the normal approach to a pooled test. If there has to be a subsequent test, then is MACO going to do that subsequent test? Is the parent expected to do the subsequent test? Will that test be done at school? Where will it be done? But like I say, a normal pooled test would, right, I just take a fraction and put it into the pot, do the test on the pot, but I still have the 5/6 left over that I can look at for a second analysis.
That's more challenging with a swab, though. So
No, it's not at all, because your swab, right, the way the swab works, the swab goes into the soup. The swab isn't what goes into the PCR machine. You're going to take out a sample of that solution. That goes into the PCR machine. And the PCR machine is, again, I haven't done it myself. My wife has. Many of my students have. A PCR machine basically cycles, it heat cycles through a DNA replication cycle. So effectively what it does is it takes whatever's in this pool and it supplies the appropriate DNA base pairs so that when you do the cycle, it will amplify any DNA that's currently there. And so it really only takes sort of one strand, and you can amplify it enough that you can actually pick up the signal. So that's the way PCR works. So there's absolutely no reason why they shouldn't be able to keep, like I say, take that sixth, take 1/6 from each one, put it into the pot, run the test. You've now got 5/6 of the sample left. It's not the swab, it's the solution from the swab that gets used, and that should be able to be retested. That's normal pooled analysis.
So, Paul,
Yeah.
isn't it our understanding, though, that they're going to do a retest? They're not preserving they're not retaining each one of them and saving them, that they're doing a retest of the 6 in the pool if it's positive. Is that your understanding?
Right, so I think first to answer Dr. Martin's, the first part of your question, Dr. Martin, I think I'd have to go to Mako and find out more details about why not that method that you just described. But in terms of the follow-up test, that would be by Mako. The Mako would ask folks to come in at the next scheduled time to do the follow-up test or as immediately as needed. And those are the mechanisms of that. That's where Mako's staff will handle those pieces.
Okay.
But I think your question that also connects to Ms. Carter's question about but if it happens on a Friday, how would those mechanisms work? And that's something I'll follow up on.
Well, it's not just a Friday, right? Because as I understand it, it's going to be weekly testing.
Yes.
So if the retest is not till Mako comes back, that's a week down the road.
Right, so
That doesn't do us as a school system any good if we only get the information a week later.
Yes, sir. So I'll follow up with more details, but as we plan this out with the schools and set up the schedules, those are details that we can bring back to the next board meeting.
I will say that they have offered to come to a meeting and answer questions. What we may want to do in the interim is collect questions as you have them so that we have, and then we can either try to do it as an FAQ and then see if there's a need for them to come, and we'll start that way because they're good questions.
Well, I was wondering, thank you. I was wondering if there's other districts, since that other districts that have already implemented and had this program, what their experiences have been, what we can learn from it to make sure that we, in our memorandum of understanding, we refine perhaps some of these protocols.
Yes, ma'am. I think that's a good suggestion. So we have been in connection with folks who have experienced the implementation of the testing at Durham Public Schools, for example. We've seen some of the samples of communication. Though we haven't heard of all the hiccups, we have heard that it has been gone over well, and the fact that a parent gets to have access to a regularly scheduled pooled test available to them, that it does help them ease their minds, is one thing that we've heard from a parent.
Dr. Martin.
Thank you, and I apologize for jumping in, but it was all on the same topic, and that kind of stuff is kind of up my alley. The other question that I have, though, is I'm concerned about how do we incentivize people to become part of the pool? And some of the way it's talked about feels to me like it could disincentivize to be part of the pool, and that's not what we want. I think we want to incentivize. And so I guess partly related to slide 4, I'm trying to understand if it helps, and if not, can we make it help, that the pooled test can help be part of the quarantine issues. Now, I understand that we're not doing diagnostic testing. That does, that's a different scenario, which we don't have. But it feels to me like if a student is part of a pool and was exposed particularly, right? So it's a little challenging because we have the weekly pool instead of a more regular, but I understand the limitations. So if we've got a weekly pool, so let's say you had your COVID pool test on Wednesday, but on Tuesday you happen to have been exposed to somebody and might otherwise quarantine. On Wednesday you get your pooled test. That pooled test is negative. Does that pooled test constitute a negative COVID test that limits the quarantine? It feels to me like if it does, that is part of an incentive for someone to be part of the test. Because if I'm part of that pool, it can limit quarantine. Otherwise, I'm worried that if I'm part of the pool, the only thing that can happen to me is I happen to get in this group of 6, and now all of a sudden I get flagged, and that seems like a disincentive. And so I just want to make sure that the program that we structure is structured appropriately to give as much incentive as possible to join the pool. Does that make sense?
Yeah, if I could add one thing on that, because that came up last time, and if somebody's a close contact to return at the short period of after the 7 days, they have to have no symptoms, and then they have to test negative, but the test has to be taken no earlier than day 5 of the quarantine. So that makes it very challenging on a timing thing to be able to use the test through MACO as a testing out to be able to limit the quarantine because of the timing. So that came up last time, and I think that clarification is warranted, that if you're a close contact and don't have symptoms, the earliest that you'd be able to get back is after the 7 days, but you'd have to have the negative test, but you'd have to wait at least 5 days into the quarantine period to get it. So if you had the pool test earlier than that 5 days, so that if you happen to be in close contact with a person that tests positive, let's say you're in the pool and you're one of those 7, right? But you're negative, but you were in close contact with a person that was positive, so you're a close contact. You can't use that negative test unless you've been in quarantine for 5 days and have no symptoms. So that part, I agree about the incentive, but I did want to stress that this does not automatically count as a testing out of the quarantine, unfortunately.
And Dr. Martin, I think what you point out is like, what if there's a scenario where an exposure and the pool testing are kind of intersecting, and what happens at that point? And I think those are things that we'll have to, myself and the health services team are, I'm not sure it can exactly be a flow chart like you asked last time, but working through the scenarios and the guidance that we need to provide families, should those intersections occur, is something that we are working on.
I appreciate that. I mean, there is clearly a value add to us as a system, and if it is to us as a system, there is to everybody, because we want to maximize safety in our schools. But I'm just concerned that we to the greatest extent possible, make this a valuable thing for people to join. Otherwise, it's not going to do what we need it to do.
Thank you.
Ms. Cushing?
Mr. Blumberg's explanation raised another question, sorry. But just because your test is pooled doesn't mean the student was in the same group as an exposure.
Absolutely does not.
So if you're negative and you weren't exposed to the student who's positive, and you've been masked with fidelity, then you wouldn't have to quarantine, would be my assumption.
And
Yes,
that's
ma'am.
what
Okay, and I've been
has
thrilled
been
to see the
stated.
quarantine numbers being declining at such a rate. So we're working hard to reduce quarantines, which I appreciate. So I hope that added testing doesn't undo that good work. So,
as a general rule,
thank
while
you.
you're awaiting the retest,
Right.
that you're not required to be excluded, I guess, unless you'd have symptoms or something.
Right. Just because you are in the pool doesn't necessarily mean you've been exposed.
No, ma'am.
Thank you.
Yep. Great question.
All right. Seeing no further questions, we'll look to the next phase of the update and report in 2 weeks.
Thank you all.
All right. Thank you, sir. All right. Next up is a series of employee compensation recommendations. Mr. Matillo.
Yes, sir. Thank you, Chair Sutton. I do have with me today Mark Winters, Terry Kimsey from Budget and Finance, as well as Marcy Holland and Darren Levine from Human Resources, so they'll help chime in as well. We're here today to present, I'll wait for the slides to get out. There we go. We're here today to present the first of what we expect will be a series of recommendations to improve employee compensations through both bonuses and salary increases this school year. Our employees have worked incredibly hard during the pandemic, and we're grateful for their commitment to our students, our schools, and our district. Improvements to compensation is one way to acknowledge all the hard work that they have put in, especially during the past few years. So before we move into the rest of the slides, please understand that the compensation recommendations presented to you today are the first, but certainly not the last of recommendations we will bring this school year, which is different than in years past. These are simply the first steps we are taking to provide bonuses and improve salaries with the money we have available today prior to the approval of a state budget. So along those lines, let's talk briefly about where we are in the budget process today. Our budget process is designed to follow a certain order. In the spring, the board approves a proposed budget. And then after that, the county commissioners approve a local budget. And this is important as local funds typically cover about 30% of the school system's operating costs. Then the board adopts an interim budget while waiting for final approval of the state's budget. This is, again, a critical step in the process as state funds typically cover about 58% of our district's operating costs. So I just want to pause here to ensure folks do understand, we do talk about the state budget often, but it is 60% typically of our district funding. So it is an important source of funding for us. And once the state budget is approved, board members work to balance the district budget for 2021-2022 and adopt a formal budget resolution. So while we typically wait for approval of the state budget first before bringing compensation recommendations to you, this year we are proposing moving forward with a first step in compensation increases ahead of the state budget approval. The three recommendations will include a new recognition and retention bonus for all staff and 2 compensation increases that use local funds already included in the board's budget. Also, during this presentation, we will review planning for use of federal funds, known as ESSER funding, for additional recognition and retention bonuses both this school year and beyond. So let's take a closer look at each of these recommendations. These recommendations represent ways we can take some initial steps to recognize all employees for their efforts during the pandemic, as well as address non-certified support staff and certified staff salaries. To accomplish each of these goals, the recommendations we will present to you today use a combination of funds already included in the 2021-22 budget and a fund balance appropriation request. So the recommendations are that we will pay all benefit earning employees a $1,250 recognition and retention bonus. Second one is that we will raise all non-certified support staff salaries to a minimum of $13 an hour and provide a 1% increase in the local supplement portion of all certified staff salaries. That would be retroactive back to July 1, 2021, as would the $13 an hour minimum. And because these 3 items are just some first steps, we will also discuss the possible use of ESSER funds for providing employees additional recognition and retention bonuses this school year and beyond. Now we'll look more closely at each. First, the $1,250 recognition and retention bonus. This first item in our recommendation tonight is the $1,250 recognition and retention bonus for all benefit earning employees to be paid in November 2021 paycheck. We've gotten a few questions about the term benefit earning employees, and this simply replies to the permanent status of employment. This means anyone in a permanent position, whether it be certified or non-certified, who is employed at least 50% or greater and earns leave benefits such as annual leave, sick leave, they would all be eligible for the bonus. A lot of time people think of benefits and just think of health benefits, but we do consider leave a benefit as well. Part-time staff also received a prorated amount would receive a prorated amount based on their percent employed. The total cost of the bonuses is $25.8 million, and we would be requesting use of funds reserved in our fund balance as an action tonight as a part of this recommendation. The next item in our recommendations is an increase to bring all employees to a minimum of $13 per hour. This recommendation would include Non-certified support staff groups such as instructional assistants, CNS staff, school clerical staff, custodians, couriers, as well as many other employee groups, but just did want to highlight those. This increase would be retroactive to July 1st, 2021, and would be implemented started with the December 2021 paycheck. For this recommendation, we would use funds from the business case in the board's 2021-22 proposed budget for non-certified staff schedules. Again, note this is a first step in a series of compensation increases we plan to bring for employees this school year. This means that we will be exploring additional options for improving compensation for non-certified staff this school year and would bring those options to you soon. Along these same lines, we will also be looking at our current substitute pay rates and expect to bring a proposal for improving these rates as well. The final item in our recommendations is a 1% increase to the certified staff salary supplement schedule. I want to talk about what this is not, because there's also been some confusion from some of our employees around this item. This is not this year's pay raise. We don't know what final raises and step increases will be included in the state budget. This is also not a change in a teacher's state-based pay. This is an increase to the local supplement portion alone, which was in the board's budget. Employees paid on these schedules include classroom teachers, instructional coaches, guidance counselors, media coordinators, social workers, speech-language pathologists, psychologists, and others. This increase also would begin with the December 2021 paycheck and would be retroactive to July 1st. The cost is $1.4 million, which will come from funding, again, included in the board's budget for certified salary supplement schedules. And again, this is a first step. We anticipate the final state budget would also include changes in the state salary schedule for our employees. These three recommendations are an initial step in an overall effort to improve compensation for all staff. Moving forward, Phase 2 would include additional employee recognition and retention bonuses. This would include recommendations for use of ESSER funding to invest in all staff. The goal of these recommendations will be to offer ongoing recognition of the additional lift all staff are making during this pandemic. Our recommendations would also cover the 2022 calendar year. Bonuses would be paid on a periodic basis, for example, maybe 3 or 4 times a calendar year. We expect to have a proposal to you by December. And just note that any recommendations utilizing ESSER funding would have to be approved by DPI, so that's part of our steps as well. Just to do a review of the recommendations, and again, take a look at next steps. Tonight, we would be requesting approval with your support of 3 employee compensation recommendations as a first step ahead of the state budget approval. Pending your approval tonight, a one-time $1,250 recognition and retention bonus would be paid in November 2021 paychecks. And the increase of $13 an hour to the non-certified employee minimum rate and 1% increase in the local supplement schedule for certified employees would begin with the December 2021 paycheck and be retroactive to July 1, 2021. In addition, staff will recommend usage of ESSER funding for employee recognition and employee retention compensation for the calendar year 2022, subject to DPI's approval. We'll recommend any additional compensation recommendations using local funds upon reconciliation of the 2021-22 budget and adoption of the board's balanced budget resolution. And finally, we will implement any state legislated compensation changes following the approval of our state budget. And at this time, I'm happy to answer questions that you have.
Mrs. Carter.
Thank you. Well, I have several concerns, but my initial concern is that we are leaving out a group of staff for pay increases, for pay rate increases, and that's the non-certified staff that make more than $13 an hour. And if you look at some of that could be, for instance, a CNS assistant manager that's been with us for 4 years. That could be an IA that's been with us for 4 years. And to me, these employees definitely deserve a pay rate increase. And that's where I'm coming at, because, to exclude some of our employees, particularly those who often make the lower amounts, is quite concerning to me. Do you know how many of our non-certified staff will be excluded from the pay rate increase?
I don't know the exact number excluded. The number that would be positively impacted is around the 1,600 number, obviously leaving many of our employees not impacted by this particular proposal. And I think that's why it's really important to understand that this is just a first step. We do know that both the House and the Senate budgets included the 13 minimum, which is one of the reasons we feel like we can go this amount now as we wait. But we know this has to be a first step. I think that's also where the bonus does come in right now, to acknowledge all of these employees that have been working beyond expectations during this pandemic. But I hear your concern as well, Ms. Carter.
All right, okay, thank you. Yes, because the certified staff, and we won't get into the percent and all that of their raise, but they all are all getting a pay raise, even though it might not be significant. So, and I guess, I am glad to hear that this is just the first step. But, often my concern is it's a first step, but having an end goal in mind is very helpful to be able to share with our employees so they know specifics, because just kind of dangling out there, oh, just stay with us, is very hard to do when you, like I have said before, look at other districts who have already made significant changes, and they can see them,
Right.
and they know them. And so I hear you're saying you come back in December. At that time, will you have specifics with every, with this, the employees that are being proposed to be left out for pay increases? What will the impact be for them and all non-certified staff and the other bonuses? So kind of, I guess where I'm going is, how long are we not going to have a specific plan? Because I would like for our staff to know, because telling them and doing are two different things.
Yeah, I think the plan with the ESSER funds in particular would be to bring specifics back to you, both timeframes and amounts. And I think ideally, I'd love to bring compensation as well. I think we're still kind of monitoring a couple things to see if we can do that. But
I do think we'll also be on the other side of the CAFR and are able to provide better specificity around what that would be for all employees. I think that our 5-year plan makes it clear that we expect to get to a minimum of $15 for everyone. We are expecting that we would get state support along the way for that. And of course, the first year of the 5-year plan, we received a significant investment, and then the next 2 years have been in the middle of COVID. And so those local dollars that were going to be applied to the plan that is already in place haven't been able to be applied. And so we are looking at also, as we look at what the savings are that occurred from the past year and the pandemic, and we get on the other side of what's the CAFR and the fund balance, what can we apply further towards that locally? But we also know that in some cases, some of what we apply, depending on where those funding sources come from, create an obligation down the line. And so we're balancing all of those things as we come forward. And that is what we would bring you in December. And it is our expectation, based on what we're hearing at this point, that we would have either definitely a state budget resolution at that point, or definitely knowledge that there won't be one.
Okay, and I guess a follow-up to that, because when we were having budget discussions, I thought it was revealed at the board table that we didn't have a specific to reach everyone to 15, because I think the assumption was that's where we were going, but then it was revealed, no, that's not really. Am I the only one remembering that conversation?
Yeah,
but that was what we were told. So
that's the goal.
Okay.
But it requires, it has assumed that the state is taking a portion of that. And what the board has made clear is, because we can't rely on what the state is going to do, how do we rework the plan to figure out how we can do it without relying on what the state does? And that's the difference.
Okay, thank you.
Dr. Martin?
Thank you. A couple questions, somewhat building off of where Ms. Carter started on, how are we going to deal with the salary compression issue? That's probably the biggest concern. I mean, $13 an hour is still far too low. It's a step in the right direction. That's good. But how are we addressing the salary compression issue? Because that's probably my biggest concern of these proposals. Somewhat related to that piece, the $13 an hour piece, is the only one you didn't give us an estimated total cost. Could you give us that total cost? We heard that to do the $15 an hour and salary compression, all of that together was $98 million. We don't have $98 million sitting around to address that. So what is the cost for the 13 right now? What might even be the equivalency, or would there be an equivalency of, like the local supplement to the non-certified staff that, while still far too inadequate, could at least address a little bit of the salary compression issue?
Yeah, I think we've rerun some numbers and think probably that 13 an hour, based on folks like CNS and looking at some factors, we could probably get there for around a $3 million, just flat, taking everything out of everything else, just bringing, like we talked about, those 1,600 up to that 13, and that would give us some flexibility left to deal with some of the compression issues. Maybe bring some folks higher than the 13 ultimately once we know more about that state budget. And I think what I look at this year is we may not fully address compression, but I think the goal of ensuring that all employees see some kind of increase is going to be important.
I do also think, with regards to the compression question, there'll have to be a board discussion and decision around that. Because you can raise the minimum wage, so to speak, for a larger group and not address compression, or not raise it as much and address compression. And so I think we're going to need to see the scenarios around those numbers and determine what the board's direction on that is.
So I guess, and I appreciate that. What I'm looking for, though, is we know that all of this is kind of a token anyway. And so when you've got a token and then you're a group that doesn't even get the token of the token, that has a pretty negative sense. Now, everybody gets the as proposed, the $12.50, which is one thing. So maybe that leads toward my next question: is could that what would the cost effect be if we made that $12.50 a increase to the base instead of a bonus? I believe, and I'd love to hear sort of the details, right? What's the tax difference, the taxability difference to the employee if it's a bonus versus if it's an increase to their base? An increase to the base, we know, is an ongoing expense instead of a one-time expense. But this is something we've talked about before. We've got to address this, and we can't just wait for somebody else to take care of it. And so can we use this money that we think is one-time money to sort of try to leverage the future? Because if we can put it into regular pay, then it becomes retirement eligible and other benefits eligible, and I believe has a lower tax rate. So can you help us understand, to the employee, what's the actual spending difference, right? Because it's not $12.50 in your pocket. So what's the actual spending difference, and could we conceivably consider this, instead of a bonus, to be an increase to the base pay, because that would actually be a benefit to these other employees?
Sure. I think Mr. Winters may have to help me a little bit with the taxation piece, but what I could say is, there's, to the employee, they would pay, I think, 6% if it were part of the base pay, because that would be their retirement contribution. On the district side, we would pay, I think, an additional 22%, again, because that would be the retirement cost of putting that into the base pay, which would then increase, obviously, our costs. So yeah, if Marcy wants to chime in a little bit further.
So to speak to taxation, we pay the bonuses with their regular payroll, so it's taxed at their regular income tax rate. It's not taxed at the higher bonus rate, which is about 40%. So we tax it with their regular income, so that's a benefit to the employee.
Okay.
And that's why we typically pay them on the end of month when we have other payroll that's paid.
Can you stay in the mic?
Oh, my apologies. We pay them on end of month so that they're taxed at the regular income rate and not at the bonus income rate, so that it's tied to other income. So it's to the benefit of the employee in that respect. We also, to Dr. Matillo's point, do not deduct retirement, the 6% retirement contribution rate for those that have retirement benefits on these bonuses, and the district doesn't pay the 21.68 retirement portion that the district has to pay.
So the employee doesn't really save 6% because they lose the 21%. There is the differential.
So the difference is employer. So it'll be a $31 to $32 million commitment from Wake County Public Schools. If it was in salary, if it's in bonus, it's the 25.8. The 6% is the employee contribution that if it was in salary, they would have to contribute, but they do not have to contribute as bonus. These are non-retirement. And I think you mentioned that when you first started. It's not a retirement eligible as a bonus.
Right. So it is a short term, a little bit more money in the pocket, but for a long term, less overall money. And it's something that well, everybody knows I'm not a fan of bonuses. I want to see changes to the base pay. So I guess I don't have an answer to that. The last one I'll ask, and this was one of the employee groups when Ms. Carter said somebody's missing from this. What I see missing from this is, what about our substitutes? Our substitute pay is far too low, has been too low for a long time, and I don't see anything here addressing substitute pay.
Yeah, I did mention it just in my presentation that we would be bringing that back as well. I do know our substitute need a rate increase, and ideally would just like to time that with the next wave of increases for other employee groups. But yes, we are definitely thinking of them.
Again, the time, I'm concerned about the timing. If we don't do something with this current action, I think is not wise.
Dr. Martin, I'm following you when you talk about the bonus versus it going to the base pay and impacting retirement. But when you talk about using these funds to leverage against the future, what do you mean by that? I mean, how will we leverage these current one-time dollars and take that and leverage that against the future?
So it's politics. I'll admit it. We have to make a bold ask, whether it's, I mean, unfortunately, we only get to formally ask to our commissioners, and yet we're also asking to the state. If those monies do not become part of the base budget, then where's that pressure going to go? I mean, I don't like the politics of hardball pressure. But we as the school board would like to address the issue of $15 an hour. We got put into a corner when the state and the county went to $15 an hour minimum wage with that little asterisk, except for a public school employee. That was nasty hardball. That was really nasty hardball because the school system really had no control over it. We just had to sit there and take it. And I guess my thinking is, like I said, I don't like hardball politics, but if we've got to play hardball politics, let's start playing it. If we put this one-time money in, are the commissioners, is the state going to 3 years down the road when the ESSER money runs out, going to say, oh, no, we got to cut the salary of all these people? I don't think so. I actually, and if they do, I can't say they won't, right? When you play hardball, you play hardball. But they played hardball on us that really put all of our employees at a disadvantage. I think it's time for us to play a little bit of hardball the other direction and say, you know what? We don't want this cut. If 3 years down the road that money gets out of base salaries, it's not because the school board hasn't tried to get it into those base salaries. It's because, our friends on the county commissioner and our friends at the state didn't pick up the tab. So I understand it's hardball, but that's a little bit where I'm at.
I see.
I'm still irritated at that hardball of the $15 an hour for everybody but school system employees. That was low. And we've got to call it out for what it was. That was 100% inappropriate. Had they not done that, we wouldn't be where we are today.
I appreciate the context.
Yeah.
I got you now. Mrs. Scott.
And maybe it's almost like they knew that local counties would step in and supplement it, and then guess where 8 to 9% of that funding will go. So it's almost like a backdoor way of funding charter schools. So there's that. One of the things I'm concerned about, Dr. Matillo, is the impact on CNS. I know this year, because we're helping them in different ways. I still need to wrap my head around exactly how we are stepping in and helping CNS, because they are an enterprise. But when we commit to an increase in salary for them, which I fully support, so please don't think that at all with my question here, but when we commit them to that, are they going to have enough revenue to support that, or are we also looking to hopefully going to a normal year where they can sell lunches again, but not necessarily placing that burden on our families with increasing meal costs?
That's right. Yeah.
Yes, I think during our last meeting, I spoke to this a little bit, and it's the same thing in the future. We can do things such as not charging direct cost, which is an operational cost within a self-funded organization. We did not do that last year. In a normal year, it's probably $2 million plus that would be charged to CNS for operations. We did not do that last year. The other item that we picked up last year was all the managerial costs, not the employees within the schools, but the employees within the warehouse, within CNS management. We just took that on as a local cost. We watched their numbers fairly closely. We're not going to let them fail. Actually, after last year, they finished with one of their higher years of operating balance because we were able to assist and because we had federal and state fundings that offset their expenditures. And I believe in the ESSER application, we have a small amount of funding to assist CNS also as we move forward. So we watch those numbers to protect it, and we have several ways we can help them to prevent them from getting at a low point.
So Mark, could you clarify? So the ESSER funds that he's talking about are specific ESSER funds reserved for CNS operations. So they are working on the plan that includes some additional support for recruitment, retention of their existing and future staff. But really the question that I had was, CNS is not allowed to operate in the red, are they?
Well, no, they're not. Yeah. So they have lost money through the years and this sounds bad. It doesn't mean it's the way it sounds. Due to the Healthy Food Initiative, it was expensive. And by having that expensive food and keeping your lunch prices at a certain level, we began to lose money. So we've watched them through the years, and although they've lost money, we've kept them with a month and a half to 2 months operating balance, which is, that's a good operating balance. We operate on a week to 2 weeks operating balance as a school system. So we protect those dollars to keep them from going negative. They will not go in the red. We will protect against them going in the red.
Okay, I do appreciate that information very much, and I know several of my colleagues attended the Sustainability Kingswood Elementary, and one of the things they noted with their compost program, which composting can be expensive, however, they had fewer tips of regular dumpsters with the way they were doing things. So I think as we move forward, putting that in the back of our collective heads is something to consider to help our CNS with that. I also appreciate that we are looking to increase our substitute pay as well, and that I appreciate that that is something we'll see in December. Substitute teachers are critical to running a school. Teachers have appointments, they have children who have appointments, spouses who have appointments, they have, there's a need for them always, even in a perfect year, and it's important to have high-quality substitute teachers so that you're not worrying and checking your email on your phone the whole time. So I do appreciate that, and I would love to see if something we can also consider at some point this year, although I imagine that the bonuses that will be offered throughout the year are to address this, but we have had teachers working on their prep periods, working on their lunch. I don't know how much that's been being tracked, if it's been officially tracked on when teachers are losing that time, but if that's something we can also consider, if a teacher has worked their prep period, subbed during their lunch, or that we look to compensating those employees as well in that way. I just wanted to offer that for consideration moving forward.
I think we can roll that into the next update that we bring you.
Thank you. Those are my questions and comments. Thanks.
Ms. Haggerty.
Thank you, Mr. Chairman. So, obviously this is a subject we're hearing a lot about, a lot of people are talking about, and it's one we've talked about pre-pandemic, let alone through the pandemic. There are two areas I think we need to talk about in the work session about this. My grammar was really wrong with that one, I apologize. There are two areas we really need about this that we really need to talk about, and what I'd like to hear is more explanation. I think I know, but because I see conflicting stuff in public discussion of this, can you explain more about why we can't do more now? Because I've heard, for example, we've talked about needing to have the audit and financial report completed, but I don't know how that impacts this. I've heard the discussion about, well, I know we need to see what the state budget does, and that makes sense to me. But then I've also heard, I think either you or Mr. Winters had said that we would need DPI approval for use of certain ESSER funds. But I know that other districts have been able to go ahead with some really bolder action, and I don't know, is there a different timeline? Are we asking for something more ambitious than that? But so could you just sort of explain, or Superintendent Moore, I don't know if you could, but why can't we do more now?
I'll speak to the ESSER funds. So the current all staff recognition retention bonus that we are proposing this evening is from savings that have been identified in local. Looking at what we might get out of the CAFR and so forth, those again would be savings identified in local, not necessarily recurring dollars. For the ESSER funds, districts who submitted in their applications, we've had applications due at different times. Districts who submitted applications that included a specific amount or timeline around employee retention or recognition bonuses, and that gets approved by the state as a part of their plan. So we presented to you guys a couple of weeks ago a lot of the items that are in our ESSER plan that's already been approved. So we need to make a revision depending on the total dollar or amount that we look to see what's in our plan currently and what's available in terms of funds that are not committed, or the amount that we want to move forward, and submit that revision to the state. So we need to, it's just a revision, and we have the capacity for revisions all through the process.
So we would need, if I understand, we would need to come up with a plan, then submit it, then see if the submission is approved, or?
I think those can run concurrently.
Okay.
I believe that we can come up with a proposal with a dollar amount and move them at the same time. I don't think that one has to happen before the other.
Okay. All right. Well, then, so thank you, Superintendent Moore. So then the next question I have is that we say that we would like to do more. But other than the minimum wage, we've talked about moving that from 13 to 15 as a goal. What is more, right? I mean, is more taking a $1,250 bonus and adding another $250 to it? Is it doubling the bonus and adding the same amount at another time, or perhaps even a third time as we go forward? And so in terms of what we're looking at, in terms of providing more, I understand that if we're going to tell people, help is on the way, I think we have to set some reasonable expectation about that, what that means or what that target is, knowing that the state could throw us, throw us for a loss, if you will. Dr. Martin, when you were talking about playing hardball, I understand exactly what you were saying, and I think there's some merit to that as you talk about the county commission. I know with the state legislature, it's a harder sell in terms of leverage, in terms of influence, in terms of what we and other districts have been asking for years, and what the state Supreme Court has been demanding for years, and whether or not, there will be any relief on that front. But I think we have to kind of have an idea of what that more should be, or what we're targeting, and what we might want to do. And so, I'll throw out, and I don't know if it's achievable or reasonable or not, but in this labor market, with what we're seeing, with shortages of workers from the top to the bottom of our employment roles, who do we have to compete with? Who are we losing potential workers to? Where do folks who leave the system but stay in the profession go? I think for a lot of them, they're the areas nearby, proximate here in the Triangle. And so I'd like to see us be the leading employer in the Triangle area in terms of teacher salary, in terms of what we pay our bus drivers, in terms of what we pay our instructional assistants, our certified and non-certified staff. But I don't know what those are, and I don't know what that would cost. And so is that something that you can bring to us, like a competitive analysis, just even regionally, so we can see how we stack up and how we compare? And I think that can guide us as we set reasonable goals for what we ask for, what we push for, if other changes in spending have to be made to accommodate this. But then we'll have some real targets so we can provide the best for our team.
I think that sort of a comparison would be very helpful as you're setting the goals and the targets and the options that we bring at the next meeting. I can tell you just off the top of my head that our teacher salary compensation is very competitive because of the local supplement. It is in our non-certified staff schedules that we have greater gaps. So, but we can bring that information as part of what we bring forward.
Just to follow up, if you will, Mrs. Sutton, to Mr. Haggerty's question, which was kind of what is the what's next that we're talking about, and then if you can also add potential timeline to the what is next.
Yeah.
Well, and I would just add too, Mr. Haggard, I think when you talk about how much more, and this is something obviously we would have to work with staff with as a board, but when you look at the total amount of ESSER funds and other pandemic recovery money that we've received, and we're talking about, about 300 million or so here, I think there's a balance of how much, in my opinion, how much of that federal money do we use to front load salary and bonuses, right? Because, and then how much of that do we want to say should be earmarked and should go into classrooms and help, directly help or affect students? Because I think the more we do, the more of a slippery slope we start to approach, because as a general rule, we don't use federal funds to pay salaries. Obviously, we have some programs that pay salaries, but again, to Dr. Martin's point, salaries are is a state responsibility. And so as we kind of dip into the federal pot to pay salaries, again, I think the one-time piece is appropriate, but then at what point or how much of that or what percentage of that do we want to use federal money to front-load salaries, I think that is primarily intended to impact students. And so, and that may be a conversation that we have as a board and working with staff. What's the balance? What's the percentage? How much of that do we want to use when we talk about, well, how much more or how much can we do? That's my opinion.
I'll just add that retention bonuses are an acceptable use of ESSER funds. But there are also requirements about the percentage that needs to be used to directly support learning loss, so to speak. So that is how we're having to sort of rearrange what we've already presented to you to add the component piece of the specifics for how we would use the dollars for the additional retention and recognition bonuses. I think we have some already baked in to the proposal, but we need to really revisit whether or not that's the amount that we want to move forward with.
And I would just add, when it comes to retention is a key word when it comes to the use of the ESSER funds as it relates to employee compensation, because the idea is that, and it's in the law and it's in the regulations, it's to support the continuation of your staff and retaining them. So you don't want to pay it for services that have been rendered. You want to pay it for services that, so that you basically say that this will be paid at some point later if you stay. And that's the retention component of it. And I do, I've seen where DPI does approve those plans, and certainly, as it's been stated, it should go on the plan for approval, and you wouldn't want to be in a situation where it's not approved and then you've already paid it. So that my guidance would be to get approval on that.
And I do think, hence the longer planning nature of what we plan to bring you across more than one school year, to really stay true to the retention piece and not pay it out all at once. I think it's also important, there was a bullet in one of the slides that talked about, one option is 3 or 4 times a year. Another option is twice a year. I mean, and those are the things that we'll want some feedback on in terms of what the cost is and the frequency and those kinds of things moving forward. But that's what our intent is at probably the first December meeting.
Mrs. Kushner.
Thank you. Thank you for this conversation, colleagues. So Dr. Matillo, you said there were 1,600 employees who were under $13 an hour. Can you tell me how many employees we have who are under $15 an hour to get to the compression concerns that some of my colleagues have raised?
Yeah, it's about
Sure.
3,500 or so who are under the 15. And again, that doesn't necessarily get to compression. It may create more compression, bringing more groups
Correct.
up. So we still have to,
So-
on the other side of that.
It is a wave.
Yep.
Yes. And earlier, Mr. Code alluded to having some ESSER monies committed to a 2 to 3 year plan for social emotional support. And I think that's something we've supported as a board to make sure that our students, because this is going to be a long-term recovery of their academic and SEL performance going forward. So I want to highlight that that's still part of the plan for ESSER monies going forward. If we can add that to the context for December, because this one-time money we can only spend one time. I do wish I could spend $1 more than several times over, but we get it just one shot at this. So I think it's important for us to make sure we're taking account of the permanent substitutes that we've put in schools and some of the work we've already done that I hope is addressing some working conditions, and then looking forward how we can build on that to retain our employees. Thank you.
Dr. Martin.
Just quickly, I appreciate the call for a comparative salary study with our neighboring districts, and Superintendent Moore rightly noted that our teacher salary is higher than most of our neighboring districts, but we also live in the Research Triangle Park. And so when we do this study, I'd appreciate if we could sort of have a little bit of a benchmark comparison of employment with comparative education requirements. So, what other jobs require a BA or a BS with, some kind of a certification like our teachers are required? There's not lots of them, but there are plenty of professional level jobs that have that sort of entry BS, BA, BS requirement. how do our salaries in Wake County stack up to similar jobs, whether it's at, at SAS or at Cisco or at IBM or wherever. That, I think, would be an important reference, not for our teachers, not just teachers in other counties. So if something along that line could be added to the survey, I think that would be very useful.
Okay, thank you.
Pastor Mahaffey.
Thank you. Just a quick follow-up with Dr. Martin. I think one of the things that we see, and we know a lot of our employees are out of county. They live out of county, but they come to Wake. And so as we're looking at that, the cost of living for those other school district and school district employees, if they were to live in the county in which they work. Because I think we hear a lot from our county, from our municipalities, that they want people to be able to live, work, and play. And the reality is, not many of our, less and less of our employees are able to do that, as we see, all of these wonderful companies come in to access our education system for their employees' children. We need to make sure that our employees and their children have access to that as well. Dr. Mettello, in talking about what you're bringing to us in December, I've heard a couple things of compression for the 13, for those non-certified staff that we're bringing 13, whether it's, with a full state budget or maybe bringing something to at least address it partially. Mm-hmm. Looking at substitute pay, an additional bonus, looking at teacher-based pay and in that way. And Ms. Scott had mentioned planning period coverage pay and what that might look like. Is this for discussion, or are we going to see some action items that are attached to that?
In December?
Yes.
Yeah, we would expect to be asking for some action in December, I think.
Okay. And in addition, on Monday, we're going to, we've talked about these state disparities, and I heard Ms. Kushner in my ear saying, no, it's been 20 years, because on November 8th, the Leandro, Judge Lee is going to come out with his next decision with Leandro as well. So hopefully the state will come, but we don't know where that's going to land. So I just wanted to make sure that I was hearing you correctly with all of the pieces that were coming. And, if you're able to bring something to us sooner before December, I think we all would greatly appreciate that.
Okay. Yes, ma'am.
Ms. Carter.
And kind of just circling back, because I hear the extra duty almost for teachers, but I also wonder about all of our non-certified staff and those who actually are like COVID care coordinators, or staff who's showing up and they don't ever even get to go to the classroom they were assigned to because they're subbing every single day in another classroom. So if there's a way, I don't know, to look at it, not just, I do agree for teachers for sure, but also for all of our school staff and what they're having to do, because many of them, and like it's been mentioned before, the bus drivers doing extra routes, so IAs covering classes, bookkeepers covering class. I mean, the list goes on and on. So I just ask that be taken into consideration when we come back as well.
Yeah, and we'll definitely continue to have discussions about that. I think one of the reasons we do lean toward the bonuses, it gets challenging to figure out which group sort of should get what when we know that so many of our employees are picking up so many different additional responsibilities, just to be able to recognize all of them. But certainly we'll continue to look at that, Ms. Carter.
Dr. Mahaffey.
Thank you. And one additional piece, just as we're talking about our support staff, and, we're looking currently at 13 with the hope of 15 in the future. How long does an employee need to work at each step to get to 15? I think I looked up, step 19, which would be our front office staff, and it's, 15 years to make $15 an hour. And I don't think any one of us wants a staff member to wait over a decade in order to make what's considered a living wage. And so, I mean, if we could kind of get a little more of where we are and just that level setting and how we can get further, as we've got that end goal in mind
Sure.
of 15. Thank you.
Yes, ma'am.
And can I just add to your language, we're not waiting over a decade, they're working over a decade.
Thank you. I think words matter, and you're absolutely right. Working over a decade.
It was
Absolutely.
to complement what you were saying,
No,
but
you're
just
absolutely right.
language matters, because
like twiddling their thumbs,
Right.
but Band-Aids and working the health room and doing additional work that all of our front office staff do, in addition to answering that
Right.
doorbell multiple times an hour.
Yeah.
All right. Any further comments, questions, discussions?
So if I would just want to close by saying that, you know, what we're doing here today and what we're asking from the board is approval to acknowledge and recognize the incredible lift that our employees are having to undertake as a result of continuing to work in a COVID pandemic-induced environment and labor shortages and all of the hardships and additional tasks and work and lift, quite frankly, that they're engaged in. And that is across all areas. The other, that's the $1,250 recognition retention bonus. The $13 an hour, the 1% are items that we're moving forward with that were dollars that were included in the board's adopted budget and funded. And I just want to reiterate again that this is a first step. Our folks that work in the school system, they're tired, right? They're working hard. I have nothing but support for the fact that there are needs that are unmet that we need to be responsive to. And I want this school system and this board to do as much as they are able to. I want us to call on our county commissioners for additional support to fully implement the multi-year plan that we put into place a few years ago. And I want to call on our state elected officials to do right by public schools in terms of their commitment and their responsibility to our staff. So this is a multi-pronged approach, and this is a long game, not a short game. But I think it is one where certainly the advocacy and the intent to really bring to light where we are and the needs that we're seeing that Wake normally doesn't see, because we enjoy a higher level of staff retention and filling of positions. And so we know that it's not just here either, it's across the state of North Carolina. So I think this is a good first step, and there is still work before us. And you know, we look forward to additional feedback and questions from the board so that we can bring something that continues to be meaningful and shows our staff in our schools, you know, on our bus drivers, our CNS workers, across all levels of the organization, that we value the work that they do and that we appreciate them. Thank you.
And this will be on our action agenda tonight for the board's approval. All right, well, that concludes our, we got about 20 minutes. That concludes our agenda for the work session. If you got the closed session piece up, we'll take a few minutes and go into closed session. So if I can entertain a motion to go into closed session.
Chair Sutton, I'd make a motion to go into closed session to consider confidential personnel information protected under GS 143-318.11 A1, A3, and A6, and Branch versus WCPSS NC Industrial Commission file number 20-048330, to consult with the Board of Education attorney and preserve the attorney-client privilege as provided in GS 143-318.11 A3, and to consult with an attorney employed or retained by the board in order to preserve the attorney-client privilege between the attorney and the board, and to consult with and instruct board staff on negotiating agents concerning the position to be taken by or on behalf of the board in negotiation of price and other material terms of a proposed contract for the acquisition of real property in the Western Wake, North Carolina, having Wake County PIN 0746-86-7028.
Got a motion and a second to go into closed session for the item stated and as printed on our agenda. Is there any discussion? Hearing none, all those in favor show by sign of aye. Opposed, nay. Ayes have it. We now stand in closed session. Thank you.
We could do HR and Betty's piece, the property piece. Now, the workers' comp settlement that he's scheduled to come later.